Welcome to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have an informative and insightful show for you this evening. We're talking about the Pediatric Specialty Center at St. Luke's University Health Network. Tonight, we'll be joined by a talented panel of medical experts from the field. Stay tuned. This is St. Luke's Health Now. Coming up on this episode of Health Now, an in-depth look at the Pediatric Specialty Center at St. Luke's University Health Network. Stay tuned. Thanks for being here. Let's get started. We have an accomplished panel of guests joining us tonight. Up first, we have Dr. Tacile Andolino. Dr. Andolino serves as the Medical Director of Pediatric Specialty Services and is a practicing pediatric nephrologist. She's the only pediatric nephrologist in the Lehigh Valley. Dr. Andolino is a graduate of the University of Medicine and Dentistry of New Jersey. She completed her pediatric residency at Indiana University School of Medicine and her fellowship in pediatric nephrology at Mount Sinai School of Medicine. In joining St. Luke's, Dr. Andolino developed the network's first pediatric nephrology program and serves as the medical director for pediatric dialysis. Thanks for being here, Dr. Andolino.
I'm happy to be here. Thank you for having me.
How has the pediatric department at St. Luke's grown since you joined the network? And in particular, how has your specialty division grown?
When I first started here at St. Luke's, there were two other pediatric subspecialists, pediatric GI and pediatric endocrinology, and there was one of each. And so when I came on back in 2014, we were like the little three musketeers. And since that time, we have seen growth in including four other pediatric subspecialty divisions as outpatient care. But in addition to that, an exciting growth of a pediatric ICU, where Dr. Plymeyer is in charge and run. We have expanded our NICUs, including pediatric surgical subspecialties. So it's just been really exciting to be part of all of this in such a really short period of time.
Great information. Thanks, Dr. Andolino. Joining our panel next is Dr. Dustin Greenhill. Dr. Greenhill recently joined St. Luke's as the network's second pediatric orthopedic surgeon. Dr. Greenhill completed his orthopedic surgery residency at Temple University Hospital and his fellowship in pediatric orthopedic surgery and scoliosis at Texas Scottish Rite Hospital for Children. He's a graduate of West Point U.S. Military Academy and served as a captain in the U.S. Army. He was previously employed by St. Christopher's Hospital for Children and Shriners Hospital for Children. Dr. Greenhill has helped to significantly expand St. Luke's Pediatric Orthopedic Surgery Department by performing complex cases such as scoliosis surgery. Thanks for being here, Dr. Greenhill.
Thanks for having me.
So tell me about your background and the types of services that you offer to patients at St. Luke's.
I am a pediatric orthopedic surgeon. In terms of my background, that means I'm fellowship trained and board certified in pediatric orthopedic surgery. I've worked at a children's hospital before coming to St. Luke's. I do a lot of pediatric orthopedic trauma, fracture care, deformity that goes along with that. And there are subspecialties in pediatric orthopedics, which I additionally do, such as scoliosis, pediatric spine. And I guess we can talk about that a little later.
Great. Thanks, Dr. Greenhill. Let's meet our final panelist, Dr. Chris Plymeyer. Dr. Plymeyer is the medical director of St. Luke's Pediatric Intensive Care Unit. He's a graduate of Jefferson College of Medicine and completed his pediatric residency and pediatric critical care fellowship at AI DuPont Hospital for Children. His clinical interests include post-operative pediatric surgical care, international medicine, and organ transplantation in children. Dr. Plymeyer provides significant pediatric education and training throughout St. Luke's as pediatric services continue to expand. Dr. Plymeyer, tell us a little bit about the PICU, the Pediatric Intensive Care Unit, and what it offers to patients and to our community.
Pediatric Intensive Care Unit is an 8-bed unit at the Bethlehem campus. So the PICU takes care of children from the moment they go home from the hospital right after birth up until patients turn 21. The problems that they can have vary. They could have problems with how their heart's working. They could have problems with their brain or having seizures. They could have problems with their kidneys, like Dr. Andolino helps us with. And here at the Bethlehem campus, we're able to take care of all of that with the help of our specialist group.
It's really nice to know that we have that at St. Luke's, and if you ever need it, it's there. Thank you all for giving us some background information on your expertise and your interest in pediatric care. Next, we're going to dig deeper into the expanding pediatric services offered at St. Luke's. Stay tuned, and we'll be back after a short break. You're watching St. Luke's Health Now.
What interested me in pediatric surgery was its true general surgery. A lot of people call it the last bastion of general surgery because in adults, it's very fragmented and colorectal surgeons do one thing and thoracic surgeons do another thing, but in pediatric surgery, we really do it all. I'm Rajiv Prasad, and I'm an attending pediatric surgeon at St. Luke's University Health Network. Pediatric surgery is a very diverse field. We see patients from infancy up through adolescence. The unique thing is that it involves the parents and the family, and you have to be able to take care of the parents and their fears and their worries because it's their child that may be undergoing surgery. So technology has really changed, and a lot of it happened early on in my training. We began to adapt and evolved with minimally invasive surgery. Our optics is very sophisticated with all high definition images. Our instrumentation has gone from bulky 10 millimeter instruments down to 3 millimeter instruments. So we are now doing complex surgery with a minimally invasive approach, even in babies. The expertise of the entire team is really crucial to the way I function. So it's really a team effort from the operating room nurses, the surgical techs, the pediatric anesthesia team, and the surgeon. The most rewarding part of my job is definitely seeing the outcomes in the children. And some of those patients are our patients for many years, even until they're teenagers. So that's a really fun part of my job, to literally sometimes see these kids grow.
Welcome back. Thanks for being with us tonight. I'm Ashley Russo, and this is Health Now. We want to thank our viewers for watching our program and for providing us with questions for our panel, which we'll get to later in the show. Joining me is a talented group of medical professionals, Dr. Andolino, Dr. Greenhill, and Dr. Plymeyer. We've learned about your backgrounds and expertise in this field. Now let's talk about the new Pediatric Specialty Center coming to St. Luke's. It's so exciting. Dr. Andolino, I'll start with you. How do the pediatric specialists work with St. Luke's Primary Care, specifically pediatricians? Because of course you get very close with your pediatrician. If you need specialty care, how do you work together with the pediatricians?
So it's always one big team. I would actually include family practice in that as well, because they also provide pediatrics care here in the Valley to our patients. So as pediatric subspecialists like myself, oftentimes we receive referrals for a concern that the pediatrician or the primary care doctor, like a family practice doctor, would have, and patients would come in to see us in the office. And it's working with that family, working with their primary care physician to provide the care that that patient needs. So that may be having ordering of labs, ordering of laboratory testing and imaging, and then putting those all together to have a comprehensive plan for the issue that they came to see us. So for example, a patient comes to see me for high blood pressure. That may mean myself and my team having an evaluation for that patient, including a 24-hour blood pressure monitor study, an ultrasound at the hospital, laboratory testing if it's indicated. And all of those things can be done right here in the Valley without having to get in the car and driving several hours away.
Which is a huge comfort to parents, and especially knowing that that open communication is available as they've built that trust with their pediatrician. Dr. Greenhill, what new services have you and your colleagues brought to pediatrics in the Lehigh Valley with this growth at St. Luke's?
So I think specific to me, I know I brought scoliosis treatment management anywhere from non-operative to operative here to St. Luke's. My partner, Dr. Grimm, and I are both pediatric orthopedic surgeons, and with my addition, we can really cover every day of the week. You know, I have specialty, and so does he, in deformity management, and it's really just starting.
Dr. Plymeyer, can you tell us a little bit more about some of the other services patients could expect in the PICU? Because you told us a little bit about it, but if you find yourself there with your child, what other services are available in that moment in time?
Yeah, the PICU has been open for 2 years, and it was designed with patients in mind from the ground up as well as their families. So one of the nice things we have is that there's separate areas for the family during a stressful time to watch TV. There's a special family lounge. There's a nice complement of nurses and respiratory therapists that are just dedicated to taking care of children. So altogether, we can really provide excellent care that's also family sensitive during what's usually a really, really stressful time for the family.
Dr. Andolino, tell us about the new pediatric specialty center that's opening this spring. What services are in this building, and why is this so exciting for the network and for the Valley?
Oh my goodness. It allows for all of our pediatric specialty team, our family, to be in one house. So literally right now, we can have patients who require multiple subspecialists. They may require a GI doctor. They may require an endocrinologist because they may also have a thyroid disorder. And then, their younger sibling may have, chronic headaches and they need to see the neurologist. Wouldn't it be great, instead of crisscrossing all over Lehigh Valley, that they can go to one location and be able to see all of those specialists and just change floors?
That's a really high level of convenience. Dr. Greenhill, can you tell us a little bit about the pediatric surgery program and how it's contributed to the growth of the pediatric service line at the network?
Myself and Dr. Grimm, my partner, we are pediatric orthopedic surgeons, and our practices both are growing rapidly within St. Luke's and the Lehigh Valley. The pediatric surgery program is also expanding. We have a really good pediatric general surgeon, Shaheen Timapori, which has been the tip of the spear for St. Luke's in terms of pediatric surgery. My colleague from St. Christopher's in Philadelphia, Dr. Prasad, who was the chief of general surgery there, we both came here basically together within 6 months of each other. And he's extremely gifted and brings additional things to St. Luke's, in addition to general surgery, like chest deformities that happen in pediatric patients. A bunch of subspecialties are expanding. GI, pediatrics is hiring more people, expanding their floor. The pediatric intensive care unit is taking care of a lot of my patients. I do some complex things and they need complex level post-op care. But the inpatient unit is also expanding, and we're really excited for that.
Dr. Plymeyer, I wanted to ask you, how does your team in the PICU work with the specialists like Dr. Greenhill, like Dr. Andolino, to make sure that patients are receiving the care after they leave the PICU that they might need?
We're very fortunate that we have them to consult with from the beginning when they enter our door. So a lot of the children kind of from admission get workup and get additional testing that we really need a specialist to help us with. And they're available immediately, both in person and by phone, to help us with the initial evaluation. Fortunately, in the PICU, nearly all of our children recover very quickly and hopefully go home in the same shape or even better. And all of our specialists are available easily within just a few days for follow-up. And a lot of times they're even in communication with the family before they see them at their first outpatient visit. And this varies from children who have unexpected problems to children that undergo scheduled things like surgery or other procedures that we take care of in the PICU after.
Well, I have to tell you, I do know a couple of families who have been in the PICU at St. Luke's, and it's nothing but rave reviews at the amazing care that they received. Great information from all of our panelists, but we're not done yet. After the break, we'll learn more about the technology and services offered by St. Luke's specialists. You're watching St. Luke's Health Now. Stay tuned.
Do you want to have your child see the pediatrician, but you wonder if now is a safe time? Well visits and vaccines are more important now than ever. St. Luke's Pediatrics offers options to streamline your visit, like over-the-phone screenings before you come in, virtual visits you could do from home, and some practices even offer curbside consultations. St. Luke's wants to keep you and your child safe and healthy, so call us today. St. Luke's, my health, my hospital, our community.
Welcome back to St. Luke's Health Now, a show dedicated to giving you the most up-to-date information on cutting-edge medicine. I'm your host, Ashley Russo, and we have a really interesting show tonight. We're talking about the new Pediatric Specialty Center at St. Luke's. In case you're just tuning in, I'm joined by 3 St. Luke's medical professionals, Dr. Andolino, Dr. Greenhill, and Dr. Plymeyer. Thank you all for being here. In the first part of the program, we talked about your backgrounds and some basics of pediatrics. Now let's dive deeper into specific treatments and new technology offered at St. Luke's. Dr. Andolino, you are the region's only pediatric nephrologist. Can you tell us what that means? What is it to be a nephrologist specific in pediatrics? And what can you offer children and families? What types of patients are coming to see you?
So as a pediatric nephrologist, I tell my kids that come to see me that I'm a bean doctor and that our kidneys are really smart machines. They work to balance the electrolytes that you have in Gatorade, balance your blood pressure, help do all these little things behind the scenes. I can see patients for something as simple as there was an abnormality in their urine testing, all the way to they have an issue that is causing them to have kidney failure or kidney dysfunction and unfortunately need dialysis. And so here in the Valley, working as the only pediatric nephrologist, we were able to create this entire division from scratch. I'm very proud of it, and have a pediatric outpatient dialysis unit as well here in Allentown. So we are able to offer both inpatient through our ICU as well as outpatient chronic dialysis to our patients that need it as this life-saving treatment on the way to getting a transplant.
I love to hear your passion and enthusiasm about this because it is an exciting thing to be able to build from scratch and offer here in the Lehigh Valley. And for anyone who is familiar with dialysis, it's frequent. So to have something that's convenient for families is really wonderful. Dr. Plymire, I want to ask you a little bit about how the growth of surgical specialties, so something like Dr. Greenhill in orthopedics, how has that impacted the PICU and what you're able to offer patients?
So we've seen really significant growth in a couple of different areas of surgery at St. Luke's. The first program that started was pediatric general surgery. So these are surgeries that are performed on any child that's less than 18. And we've had a variety of cases, including things like complicated chest masses and other kind of really involved surgery where you need not only the specialty of pediatric surgery, but you also need a great ICU where they can recover after. We were fortunate to have Dr. Greenhill join us last year. Since that time, we've been doing really complicated surgery for scoliosis, which is a problem that many teenagers get. These surgeries are really prolonged and complicated and often take the better part of a day. The postoperative recovery period can be really involved and intense as well. So we're really lucky to be able to collaborate with them as well. And then in the past year, we've also had pediatric ear, nose, and throat doctors who have been helping us with children who have severe obstructive sleep apnea or really severe snoring that can actually be life-threatening.
You know, it's amazing when you have a child, every sneeze, cough, scratch feels monumental. And all of you are dealing with things that are quite advanced care. Dr. Greenhill, can you tell me a little bit more about some of the conditions that you treat and the types of families and children that you may see?
The most common thing that I treat are pediatric fractures and pediatric trauma. The most common thing for a child to do, obviously, is fall off the monkey bars or fall, playing around or at sports. And kids break their bones differently than adults. They're treated differently. Most of them can be treated non-operatively if you do it right. And the ones that do need to go to surgery really should hopefully have a minimally invasive procedure.
Dr. Andolino, what is your approach to patients? And when you know a child's going to need dialysis, not only what services are available, but how do you approach that with families and with the kids involved?
Being a parent myself helps me to put myself in my family's shoes. My approach to taking care of any of my patients, my families will tell you, and I tell my families that myself, all of my kids that I see here in this office are my babies. I didn't give birth to all of them, but they're my babies nonetheless. And so I take that approach of what would I want to see happen for this kid? What would I see happen for this family? And so if that means that we need to take more time to go over something, go over a plan, make a different treatment option for this family because this is not the direction things need to go, that's what we're here for. That's what we do.
And it's so comforting to know that all of you are here for those needs. Dr. Plymire, I know that this department has grown so quickly and is offering so many services. What else can we expect to see added? What else would be helpful to families that are experiencing some sort of health crisis with their child?
We're going to soon have our pediatric floor co-located right beside where the PICU is. That'll allow families, as their child improves and is ready to leave the ICU, to kind of have a seamless transition. So it'll be a group of nurses that'll collaborate really closely together. It'll be a similar environment with similar kind of setup and appearance. That'll be really reassuring with families. In the upcoming year, and in 2022, we'll be adding our child life services. So these are specially trained people that are involved in explaining procedures to kids, reassuring them in times of stress, and helping them kind of cope with the acute stress of medical procedures and uncomfortable things. So it'll be a great asset to have here at St. Luke's.
Such a great addition to the whole program. And I do want to mention, you mentioned the nurses and the medical support staff, especially in pediatrics, are so critical to the success of what all of you can offer and do for the patients. Dr. Greenhill, when you see a child that's been injured playing sports or falling off the monkey bars, what is your approach to them, and how often does a child need surgery or maybe physical therapy or some other different type of treatment? What's your role in that?
So kids rarely need surgery. I think in any pediatric condition, with a few exceptions, and that's our job to know, I think, bad fractures involving growth plates that are more rare. But most things can be treated non-operatively, and the way you treat it non-operatively is very important in terms of the type of cast or splint you put on, how you follow it in the early course. When they heal, kids heal very fast. You have to listen to the parents and what they want out of the treatment course. With regards to how they heal, kids really heal well. Makes our job way easier than our adult colleagues have it. Sometimes it's a challenge because if we need to do surgery, we need to treat something, and we want the kid to be perfect, we have to act pretty fast. Physical therapy, kids almost never need physical therapy after routine fractures. They come out of the cast and they do it by themselves.
They live life, and by living, they're moving, right? So they're not sedentary like adults.
They do. I always tell parents when they're healing a fracture, when they finally come out of a cast, my favorite day is when I can tell them, go be normal.
Thank you all for such an engaging and interesting conversation. Up next, questions from our viewers. Stick with us. You're watching St. Luke's Health Now.
St. Luke's knows that trust is the foundation of all relationships. It's earned over time. It's the type of relationship you should have with your healthcare team. While our healthcare needs are different, one thing is constant. St. Luke's is focused on building a lasting relationship with you, earning your trust and putting your well-being first. When it comes to great healthcare, trust is essential. St. Luke's, the care you trust, now more than ever.
Welcome back to St. Luke's Health Now. I'm your host, Ashley Russo. A special thank you to our outstanding panelists. We've had a great conversation about the new exciting pediatric specialty center at St. Luke's. Now we're going to read some questions from our viewers. All right, Dr. Andolino, we've talked about this pediatric specialty center opening. What can we expect from that? What will families see and experience in that wonderful center that you are so excited about?
I know, I'm like, can I get to explain? So in our house, it's going to be a very interesting sensory experience for our patients. The theme and how the floor and the building itself is set up will take you through different landmarks that you can expect to see. So you'll have a ground level, you'll have an aquarium area, you'll have a subterranean area, and then, space. In addition to that, there is also the opportunity for some of our patients, as well as our families. They're always creating artwork and things that we enjoy or gifted to us here, and paper and plastering my walls here as I speak. That's also going to be a part of the building. And so I think that having them have a piece of themselves represented there in the space that they get their care is just amazing.
Dr. Plymire, this person in our audience asked the question, if my child needs emergency care, can they go to any St. Luke's ER even though the PICU is at Bethlehem? And how would you connect them to the services they need?
So we're very fortunate that we have 12 great partner hospitals in the St. Luke's network. We very routinely get referrals from the hospitals that are right outside of the immediate Bethlehem area. So you can truly present to any of the emergency departments in our network and get the same great care. We have a very quick communication network that helps us kind of give initial input and initial management advice right from the get. And then after that, we have an entire team dedicated to rapid transport of patients. So within an hour, you can be relocated basically anywhere from our network to the Bethlehem campus in the ICU.
Dr. Greenhouse, surgery can be really scary for children and for their families. How do you approach the families, in particular the parents, when they're going through a surgery with their child?
So when you meet parents and you meet patients, you have to make sure that the kid is happy and that the parents are completely understand the treatment plan and aren't too scared of the fracture that their child needs surgery for. But more importantly, and St. Luke's is doing a really good job at this, everybody around you has to know how to take care of kids. And so we have pediatric anesthesiology. We have separate waiting rooms preoperatively for the kids. We basically have a couple different pathways, and even postoperatively, they go back to the pediatric floor and are taken care of by pediatricians. So that's basically kind of the way we manage pediatrics here to make sure people are comfortable.
I love that. And as a parent, it's great to know that every step of the way you're going to be working with an expert who really understands and cares about kids. Dr. Andolino, this person asks, what does this growth mean for my family and other families in the Lehigh Valley? How does this change our region?
It just allows patients and their families to have the opportunity to have their care done for their children right at home. And when we're talking about kids and their developmental progress and their processes, they require being in school and missing time from hanging out with their friends and being able to catch up on schoolwork. All of these things can be accomplished right here without potentially missing a step or missing a beat. We're all here to be able to allow these kids to continue to live their lives fully without having the significant impact or burden that could come with having to deal with seeing multiple specialists.
All right, Dr. Greenhill, we have another question from a viewer that I think is for you. What are some common things that children could be born with or develop that might require them to see a specialist in pediatric orthopedics?
We treat so many different congenital deformities or syndromes. I tend to see a lot of scoliosis. Some of the types of scoliosis kids are born with, and some of them develop the most common type develops in their preteen years. Hip dysplasia is something kids can be born with, dislocated hips, unstable hips. That's something we specialize in. Dr. Grimm and I, club feet. I took care of a girl recently who we took care of it as a teenager, but she had a leg length discrepancy her whole life until the shoe lift was just too much for her, and then we fixed that. And so there's just a plethora of conditions.
Dr. Plymire, this is a great question from one of our viewers. What's the difference between the PICU, the Pediatric Intensive Care Unit, and the ER?
So the emergency department is specially trained in the initial stabilization of an injury or a health problem. So for things like if an older person has a heart attack or if a baby's having problems breathing, they're very well trained and very well set up to provide the initial stabilization and care. After they stabilize the patient, they'll refer them to us. So we help with additional procedures, we help with additional management, and we can provide very advanced therapies and help with breathing and help with blood pressure management and help with supporting the kidneys with the help of Dr. Andolino, all after that kind of initial first half hour or first hour after a child comes to the hospital.
Dr. Greenhill, what do you recommend to parents who might have a concern about their child and they're not sure where to turn? What's the first step that they should take?
First step is almost always ask your pediatrician. If you're concerned that the primary care providers, especially in pediatrics, and everybody obviously in medicine, we really care about these kids, and we want to get them to the right place. There's no egos in pediatric medicine. I do not mind seeing a patient that a pediatrician thinks they have scoliosis, and then I tell them they don't. Those are the best visits. So it's always easy to start with the pediatrician. And one thing they're definitely trained to do is refer appropriately and get you into our hands if you need to be.
Thanks again to our amazing panel and to all of you for tuning in. For more information on the pediatric services offered at St. Luke's University Health Network, please visit their website at sluhn.org or call InfoLink at 1-866-ST. Luke's. I'm Ashley Russo. This is St. Luke's Health Now. Thanks for tuning in. Until next time, be well, and remember, it's important to focus on your health now.